So we're here at iMedical, and we're very, very lucky to be meeting with the Sollay Kenyan Foundation. We've got Modesta Visander, and we have Dr. Terrence Baker. And folks, I wanted you to just give us a little bit, a brief overview on the Sollay Kenyan Foundation, about what you guys do, where you're at now, and where you're going.
Thank you. I guess it's been about 10 years ago. Modesta and I, while working together, practicing medicine here in America, both family medicine and geriatric medicine, we began to explore our dreams that both of us had since we were young children. Modesta, growing up in Kenya, had a dream to make health care better, to save lives of family members, friends, neighbors that she saw dying all around her as a child growing up in Kenya. She had a dream to come to America to become educated as a nurse and a nurse practitioner. We teamed up. I, Terry Baker, come from a small town in southeast Pennsylvania called Delta, Pennsylvania. Also grew up in a small community where lots of people seemed to get sick and didn't always have the care they needed to get well. But out of that, I saw a physician, Dr. Joseph Hunt, who taught me that a family physician in a small community can make a difference. So Modesta and I teamed up at the hospital where we practiced and at the nursing home where we were caring for patients. And we developed a foundation, the Sollay Kenyan Foundation, for the goal of saving lives and for developing a foundation that would open up over 300 healthcare facilities and diagnostic centers scattered throughout the continent of Africa at key locations. The goal would be to provide basic family practice care that could make a difference and could save lives and cancel appointments with death. And so we started that dream with our first hospital, and Modesta will pick up the story, but we started that with our first hospital in October the 1st, 2018 in Katani, Kenya. Modesta?
Thank you. On October 1st, 2018, we opened our first facility, Katani Hospital. It's in the outskirts of Nairobi, about 30 miles away from the city. We're open. We are taking care of patients. We're about 144 bed facility, and it's a full-fledged hospital. I just want to thank Dr. Baker for really just committing to this cause. He has been to Kenya several times. We have taken care of very complicated cases in Kenya. He has volunteered his time and resources to come to Kenya to make sure that this cause continues on. So I want to thank him for that. But even here in America, Sollay Kenyan Foundation is also taking care of patients who are not insured. African patients who are not insured come to the office. Under the foundation, we take care of them. We had a Nigerian patient who had a tumor on her neck, had no insurance, had just gotten here, had 2 children, didn't know what to do, brought her in the office. We diagnosed her, referred her to appropriate specialists, and she was taken care of. We have another patient that had no insurance recently, that had brain aneurysms, and came to the office under Sollay Kenyan Foundation. We were able to take care of him, and we referred him to a specialist. And so the foundation is actually not only taking care of patients in Kenya, but also here in America, we've taken care of African Americans. We've had a patient from Bolivia. We've had different patients come to the office and under the insurance because they're not able to pay. We have been able to take care of them. So I just want to thank Dr. Baker for even accepting to do this, because it's not easy. It has its own challenges. We go to Kenya. Instead of him being here, he comes to Kenya so frequently to assist, to make sure that what we have started continues on. In Kenya, we've been able to take care of some real challenging patients who otherwise would have died. You're making a difference in the community. We're making a difference here in America. And I'm just urging anybody who wants to team with us, who wants to support us in any way, because we cannot do this alone. We need support from you and anybody else who is willing and who is available, through time, through money, and through any other way that you can, so that we can continue on. We can save one life at a time. Thank you.
That's phenomenal. And Modesta, if we could, can you go ahead and plug the website address? Give us the website address of where they would go. I'll have it down here, but it's SollayKenyaFoundation.org, correct?
Correct, yes.
Okay, fantastic. Thank you so much for your time. Best wishes to you on everything you're doing. And if anybody's out there, please make contact with them, and they'll be more than happy to get back with you so you can all start working together.